Good evening, dear friends. So, we are back with our latest episode of Diabetes Bytes. And as you all are aware, we are running a very big campaign related to food care in our country, where we are creating awareness about food problems among healthcare professionals as well as people living with diabetes or diabetes community. And today, uh, uh, a session related to that, we are here from the Diabetes Food Task Force. I am Dr. Pratap Jethwani. I am member of Diabetic Food Task Force as well as Executive Committee member of RSSDI. And with me, I am field of diabetes food from the city of Kolkata, and who is also a member of the Diabetes Food Task Force. So welcome, sir. Welcome to this Diabetes
Thank
Bites
you.
episode.
Thank you, sir. So, uh, thank you very much. As we have got a point that today Dr. Sujeeth Jha and Dr. Amit are not going to join due to some emergencies, and Dr. Purvi Chawla is also having some problem. So, we're starting this diabetic bite program. This campaign, Save the Feet and Keep Walking, is one of the very great initiative from the RSDI on this Golden Jubilee year. And as you all are aware, in last from started from 10th of July till 10th of August, we are going to screen a target of around 1 lakh people for diabetic foot screening. So everywhere in the country it's going on. So is Dr. Jethwani, you are connected? I think there are some technical glitches, but so uh, we can have the first question which I wanted to ask to Dr. Jethwani, that what is the prevalence of amputation in India and how many amputations are attributed to foot ulcers. So the time meanwhile Dr. Jethwani joins, I can continue with it, that prevalence of amputation in India is around 100,000 amputations every year, means around a lakh of amputation every year, but and across the globe around a million amputations every year. So important problem with us is we don't have any amputation registry. Even RSSDI or DFSI try to make a registry but unable to do that. So most common cause for amputations in our country is diabetes. Then of course accidents, war, landmines, all these are the other issues which may cause amputation. But the non-traumatic amputations, the first cause is diabetes. And we can divide the amputations in two. One is the major amputations, other is the minor amputation. So minor amputation, I can say toy amputation or toy disarticulations. Then you can have a ray amputation which involve the metatarsal also. Then you can have transmetatarsal amputation. These comes are the minor amputation, while the others chopard or you can say Symes amputation nowadays very uncommonly performed or not performed, because quality of life or patient able to walk in that situation is very poor. And the major amputations are either below knee amputation or the above knee amputation. These are the two ways it is done. And out of the around, if 10% is the major amputation, then 1%, 10% is the minor amputation, then the major amputation be around 1%. So just like that, that is the prevalence of amputations. And most of these are attributable to the diabetic foot ulcers. And the most common reason behind it is the in our country is the diabetes foot ulcer with infection, and infection carries a high rate of amputations. Dr. Purvi, are you able to join? Dr. Jethwani sir, I think there's a lot of technical glitches which we are facing today. So now the another question which everybody is interested to know about, what are the common foot problems encountered in those with diabetes. And the common food problems we all know, as the ulcers is the most common, which is the maybe neuropathic, ischemic or neuroischemic. And then the other problem, food problems, which we all can face, is the injuries. Patients who are having loss of protective sensation or neuropathy, they are unable to feel when they are walking barefoot. They may have sharp injuries, or on account of this uh, yes, Dr. Jethwani, have you joined? So, sir,
Yes,
my question to you is, which are the food problems encountered in those with diabetes? Yes, Dr. Jethwani.
yes, sir. Sorry for that. I think internet connectivity is a problem here. So I think routinely we encounter a lot of variety of food problems, starting from simple things like tingling and numbness, which patients experience, particularly those who are having long-standing diabetes, and many a times the presenting symptom is that tingling and numbness. कि पाँव में दर्द हो रहा है या पाँव में झुंझुनाहट हो रही है, and people they get themselves tested for diabetes and they got detected that they are having new onset diabetes, or they are already having high sugars and they are not knowing, and that is the presenting symptom in many of the patients, particularly in this rainy season. If the people they keep on working in those dirty water areas, then there is a very high risk of fungal infection between the toes. And particularly if minor cuts are there and they are not taking good care of that, then the risk of infection is very high, particularly during this rainy season areas. So I think they have to be very careful, and daily food examination is very much important, because I think this is one area where prevention plays an important role, because the complications which occur when you don't do daily food examination, when you neglect these food problems, when they are very quite minute or small, they are very deadly and they are very dangerous. So prevention is main part, and I think probably because of that only our Vice President Dr. Vijay Vishwanathan has developed this agenda of this campaign, that is save the feet and keep walking. Am I audible, sir?
Yeah, yeah, you are audible. Yes. So,
Okay. Okay.
as you have mentioned, and I would just want to add two, three more things. This is fissures and cracks, which may occur in diabetics, which are
Yes.
their deformities, and formation of callus. These are very important and very simple things. Shoe bite in
Yes.
diabetics who is having neuropathy, already having a loss of
Yes.
protective sensation,
Yes. Yes.
which we are testing. We are doing a test for the loss of protective sensation by 10 gram monofilament at the sites which have mentioned grade
Mono.
2 first and fifth
Mhm.
empty heads. And if loss of protective sensation is there, then these patients are prone to develop
Yes.
shoe bites. And even in our country, especially in the rural areas, rat bite is one of the very big problem. People sleep on the floor or on the bed, and
Yes.
if there
Yes.
is a neuropathy, then these are the other problems which may occur. Then the nail lesions, which are also very common in diabetics, especially the
Yeah, that is
uh,
also very common. That is also very common.
yes, sir. So these things to be taken care.
Yeah.
So Purvi, are you? No, I think Dr. Purvi Chawla is unable to join because
Purvi
he is
is
having
having
some
some
problem.
technical problem, I think. Yeah, yeah. I am also having internet instability here, so
Yes,
that my
yeah,
voice is
yeah,
breaking in
yes, sir.
between. Yes.
Yes, sir.
Yes.
So, sir, my other question to you is: uh, patient come to us and say, my doctor often tells me no for foot massage. Why? What's wrong? My sugars are quite normal. So why my doctor is saying that no foot massage?
I think it is not at all absolute no to foot massage, but most of the time when patients they undergo foot massage, and if they are having neuropathy and their skin is soft, and if they keep on pressing that for a long period of time, and if they apply hot water and other things, I think there is a risk of burns and injuries to skin. And these minor injuries they are not visible to patients' eyes, and when they get infected, they turn into a very really big nasty problem for the patients. So generally we tell them not to have foot massage. A very mild soothing, they can with they can rub their palm with very light pressure on their foot or sole if they wish, but otherwise the routine massage which is being done by people, that is best to be avoided, particularly in people who are having neuropathy. And most of the time neuropathy is asymptomatic. Patients may not be having many symptoms or most of the symptoms which are related to neuropathy. You have to undergo testing, and that will only give you a clue whether you are having neuropathy or not. So that's why it is necessary, and most of the time doctors, they advise their patients. So your viewpoint on this?
This is exactly what you have said, and you have given a very good message that all the patients who are having neuropathy, they should avoid. Because of neuropathy, there is a changes in the temperature, and there is a pain and risk of burning of the skin is there, one. And there is sometimes, if they put the more pressure, and these patients already having a hyperviscosity, in that situation there might be risk of DVT also. So if patient is diabetic but not having loss of protective sensation or not having neuropathy, they can go for a massage, light massage,
Massage.
as you have nicely explained. But if patient who are having the neuropathy, they should not go for massage, preferably they should avoid. Yes, agree, sir.
I sir, your view about this campaign, how it will affect the community at large as well as the healthcare professional community as far as food care is concerned.
Actually, what I'll say whenever I talk about diabetic foot, that it is one of the costliest complication and most neglected specialty of diabetes care. But in
Yes,
last 20 years, scenario has been changed. More and more people are interested in diabetic foot care. And you see, cost of management or treatment of diabetic foot is more than five most common cancers. That is just like prostatic cancers, breast cancers, or lymphomas. Today only, one patient came to me, and one of my friend was just came to see me standing, and patient's relatives wife and patient told me, sir, we have sold our house for the care of our diabetic foot problem. He landed with major amputation. He had angioplasty of the coronaries, angioplasty of the foot, and even after that. So these are the high, very costly scenario. And about creating the awareness, I think under the leadership of our central committee, especially Dr. Bashant Kumar, Bansi Shabu, and our RSDI task force chairman, Dr. Vijay Vishwanathan. So I think it's a great, nowhere in the world, I think this sort of screening has been occurred in 1 month
yes,
time, 1 lakh foot screening. It's a big, big uh, task to do that. And
yes.
we are doing, and probably we are forwarding it in a big way. And people are really, everybody, all the RSDI members are interested and they are doing. And probably this is going to uh, improve the foot care, and people will take interest. And I always say, whenever a diabetic patient comes to you, please start your examination from foot to head, not
Food,
from head to
food.
foot, apadamastak in Sanskrit. So everybody will have a habit to examine the foot, so which is going to go in long way. And probably outcomes will be, it will reduce the amputation rates. Yes, sir.
Yes, sir.
Your
I totally agree with you. And I think this is a big movement which is being started there by RSSDI. And we are interested in mainly creating awareness at the grassroots level, the place where we can prevent foot lesions to occur or foot lesions to progress to a level where they become deadly and costly affair for people. So a simple ulcer, if they take proper care, if they go to a surgeon or a diabetic foot specialist, and if they take proper care of diabetes as well as that ulcer, that is not going to harm them more. And that is the reason we are creating this awareness. And I think uh, this is a movement, and we look forward that each and every member of RSSDI actively participates, not only for this month, but they carry on this activity in near future also, so that we give due importance to food. And as Dr. Goel has very well said, that this is the most neglected part of diabetes. When a person comes, a diabetic patient comes to your clinic, this is the most neglected part of examination, both from the viewpoint of healthcare practitioner as well as from the viewpoint of patient also. Patients, they are generally not interested in showing their feet, removing their shoes and this and that. And doctors are also very busy in their OPD. So they are generally, if the patient is not having any complaint, they don't examine their feet. But it is prudent to examine foot of your patient who is coming to your OPD at least every 6 months if there is no problem. And if there is problem, then every visit you have to examine their foot, and you have to explain your patient also about daily foot examination, because as sir has highlighted, this is very costly affair and it has got a lot of morbidity and mortality, and it is one of the preventable complications where very little investment in preventive strategies will give you a large returns as far as the costliest complications like amputation, angioplasties and other things are concerned. So I think this is going to be a very cost effective manner of preventing foot care, and probably we will set an example for the global community that yes, if we are doing it, everybody should do it, and everybody should try to create awareness about foot lesions, not only in people with diabetes but also in healthcare community.
Fully agree. Fully agree. Well taken, sir. And I think in routine practice, each and every physician, diabetologist, and of course endocrinologist, everybody should do a foot examination whenever a diabetic patient comes. This is the message for this. Uh, I can say our campaign, Save the Feet and Keep Walking campaign, which is started by the RSDI. It's a great campaign, and I think it will go in long run, as I think the international community will also learn from it, and especially in not in the developing world, even or underdeveloped world, even in the developed countries, it is a big problem, and the cost of treatment is very high, and the morbidity and mortality is also high. So this is very important. Point is well taken. Yes, sir.
And I think almost all state chapters, they are participating in this movement, and we are just now 6 days short for this campaign, completion of this campaign, and we expect a very active participation from all the members who have registered for this campaign, and all the members or all the people who are interested in diabetes, management of diabetes or diabetic food. This is whether they are member of RSSDI or not member of RSSDI. They can register still for this campaign on our website rssdi.in. They can go to the portal of Save the Feet. They can register their name in clinic, and they can start enrolling patients and entering their data in that portal. And I think with active participation of all of you, we will be able to reach that target of 1 lakh foot
One.
examination by 10th of August. And recently, Professor Dr. Mohan has also blessed this campaign and has started a big campaign at Tamil Nadu state chapter where they are targeting 10K feet examination in these days. And with his blessings and with support from all of you, with active participation of all the task force member, Dr. Ghanshyam Goel, Dr. Sujeeth Kumar, Dr. Rakesh Goel, Dr. Ashok, myself, and Dr. Amit. I think Amit is working very hard for this campaign.
Yes,
Dr.
very hard.
Vijay Vishwanathan is also encouraging all the state chapters and their secretaries and committees for active participation. And Dr. Anuj, our another vice president, is also daily contacting every state chapter for their active participation and for increasing the number of people who are being registered for this Save the Feet campaign. And I think with support of all of you, all the members, we still want your active participation because we are now only 6 days away from the deadline of 10th August. And I think together we will be able to reach, if we each one of us who are registered in the website, I think almost more than 5,000 people they are registered for this campaign. And if each one will keep on doing at least 10 patients every day for next 5 days, I think we will be able to reach that target of 10 lakh easily by the end, by the 10th August. That is what we have thought of.
Yeah. Now, Purvi, you can take the charge. So now you joined, so you can take the charge.
Thank you so much, sir. We are just really indebted from RSSDI Diabetes Bytes team. That today the RSSDI Diabetic Food Force Task Force has come on, and both of you have given us such lovely insights. I was backstage listening to the entire episode. So thank you once again very much on behalf of Dr. Vasant Kumar sir, Dr. Sanjay Agarwal sir, and the entire executive committee. Dr. Pratap sir already knows he's part of it, and the social media team. So thank you for actually updating us on the progress of the campaign as well as giving us such practical tips. I'm sure it's benefited a lot of our physician friends also who have joined in, and all people with diabetes, because I think ultimately it's a joint shared responsibility that we prevent amputations, the worst dreaded complication of diabetes. So, once again, I thank you very much for your efforts for today.
And a big thank you, Purvi, for running this campaign, for supporting this campaign by running Diabetes Bytes. I think since last 1 month you are running this related to food related problems only and different languages. And hats off to you for running this show continuously. I think what is the today's episode number?
12.
Sir,
12.
in a few words, it is 129, but we've done far more than that. Sometimes we have more than two episodes in each series. So
Series.
it's many more than 129, but
So
it's
I
only
think
because of all of you.
so I
I
think
think
you have
we should
already scored one
actually,
century and probably you are going to score many more centuries.
Not
we should
without your blessing, sir.
we should thank Purvi for arranging so nice shows which are encouraging, and it was really important for all our colleagues and to all are involved, and he's really actively involved and putting lot of effort to have this diabetes bite program, and where she's discussing all the common questions which are really important for our physician colleagues or diabetologist colleagues, or even for the patients. These are very important, and in the different languages which she have covered. So really, hats off to Purvi. Thank you very much. Thank you.
Thank you, sir. Thank you for this
Thank you. Thank
responsibility,
you.
and thank you for this opportunity to be able to contribute to something so important. And it's not without blessings and efforts of experts like yourselves, because otherwise this program was just not going to be possible. Thank you.
Thank you,
Jai
Purvi.
Hind.
Thank you. Thank you, Dr.